Hello, Jane. My name is Monica Mathis, and I'm one of the nurses here in the clinic. How are you today? Good. So I'm here to prep you for surgery, to kind of give you a little bit of an explanation about the procedures, and then answer any questions that you might have. So it looks like today you will be having the Mohs surgery to remove a basal cell carcinoma. And so this type of skin cancer lies in the epidermis, or the top layer of the skin, and if not treated, then it can spread into deeper layers of the skin. So that's what we're going to do here today, is make sure that that doesn't happen. So Dr. Jones is our best dermatologist. He specializes in the Mohs surgery and the pathology of many different types of skin cancers. So with the cancer being located closer to your eye and your nose, we want to make sure and be able to let you keep as much healthy skin as possible. So this procedure is done in stages. So what we'll do is we'll bring you back into the procedure room, and Dr. Jones will use an ink pen, and he will draw a little bit of an area around that basal cell carcinoma, and then he will use a dermatome or a scalpel to cut out some of your skin. So then we'll bandage up that area, and then we'll bring you to a waiting room. So once we have you in that waiting room, we'll bring that skin sample to our lab, our in-house lab. And then what Dr. Jones will do is he will cut little pieces of that skin, and then he'll look and see how deep the cancer is. So if the cancer is in some of the deeper layers, what we'll do is we'll bring you back into the procedure room, and then we'll take a little bit more of the skin out. And so if there's not any in the deeper levels, that means we got all of the cancer in that little bit of skin that we took out. So depending on kind of what layers the skin or the carcinoma is in, then we'll bring you back in, we'll repeat the procedure, we'll stitch you up, and then we will be able to start sending you on your way. So knowing this and kind of the process, the surgery can be extremely fast, or it can take a few hours depending on how many times we have to get you in and out of the procedure room. So with all of this being said, the purpose of this surgery is to make sure that you can keep as much healthy tissue, skin tissue, as possible. So once you're at home, the most important thing is for 24 hours that you do keep that area bandaged, because we want to be able to reduce the possibility of infection. So once that 24-hour mark has passed, then we do say that you can take off the bandage, let it clean up, start kind of airing out, change the bandage, making sure, like I said, that we keep it clean and reduce that risk of infection. And I'd also like to warn you about the possibility of some slight scarring. So the scarring becomes more of a risk of a possibility when we enter the dermis, or the middle layer of the skin. So when I said that if we bring you back in, we may have to take some of the deeper layers out, so that if we do have to cut into the dermis or the middle layer, the deeper layer, then there is a higher risk of scarring. So knowing this, if you have any specific questions on how to keep that scar clean or that incision area clean, how to reduce any of the scarring, and if you have any questions on any of that, I myself or Dr. Jones would definitely be happy to answer any questions that you might have about that. And lastly, we definitely, once we get you in and out of surgery, want to be able to schedule a follow-up appointment to be able to remove those stitches. Typically, we wait about 7 days or a full week in order to remove your stitches. So once we get you out of surgery, then we'll be able to schedule that follow-up appointment. So like I said, if you have any questions, definitely don't hesitate to let any of us know, and definitely be in there with you while you're in surgery.